therapy. Brain therapy. You know, when I first heard about brain therapy, it was really, puzzling. What could brain therapy be? We happen to live in a time, and be very fortunate to live in a time when there's a lot of changes in our medical system, the way that we're looking at our health as a human race and as a culture. We're realizing that we can do things to change our brains, to change our bodies, and to change our lives. And we see that a lot with our life expectancy really increasing, as we heard with Hans, if you were here earlier. The following statements all have one thing in common, but they all, to me, really beg a question of how. Change your brain, change your life. Change your brain, change your body. Use your brain to change your age. And I wondered, how could these have something in common? Well, these are all books that are written by Dr. Daniel Amen, who is a psychiatrist who's done a lot of brain studies. He uses an imaging called SPECT imaging, which shows changes and levels of activity in different parts of the brain. And these changes he can map over time and see how our diets, our exercise, our lifestyle can actually cause changes in our brain. He also has shown changes in our brain in different cycles of our own hormonal cycles and things like that. Really fascinating work. But what if somebody said they could change your brain by touching your head? Well, that's exactly what I'm here to talk about today. Dr. Bruno Chi Clay is a French-born physician who has developed a treatment technique which actually works on the brain, right through the cranium. Before he developed the brain treatment technique, he developed a manual therapy technique for treating the lymph system. And the lymph system is a very complex system in our body that is all about moving the fluid, body fluid, bringing immune cells into our body, releasing toxins, and moving the interstitial fluid. His manual treatment of the lymphatic system has really changed how we approach treatment for lymphedema, and has also revolutionized some of the other ways we can maintain the health of our body. He developed a way to feel the intensity, the depth, and the rhythm and the movement of the lymph with our hands. And so that instead of just trying to force the lymph move a way that we think it's supposed to go, we can actually help our body change the route of the lymph to the way your body can individually utilize these fluids to the best, your highest good. What Dr. Chi Clay realized was that there's different layers of the brain that have lymph. The dura mater, which is not actually in the brain, but between the cranium and the brain, and the pia mater, which is a covering that adheres to the outside of the brain, and these have lymph. And Dr. Chi Clay realized we could actually move the lymph right through the brain. And from there, I believe he went on to moving the brain structures. His work is so groundbreaking that Dr. Mahelma Oz has had this quote about, well, obviously it's not up there, but he has a quote about Dr. Chi Clay's work about lymphatics being the next frontier of discovery in human disease. It was long ignored because of the subtlety and complexity. The mysteries of our cellular waste disposal system have been comprehensively deciphered by Bruno Chi Clay. So Dr. Chi Clay's work is groundbreaking and receiving a lot of attention globally. Dr. Chi Clay is currently teaching this brain therapy technique to a lot of physicians in Europe. Mostly in the United States, it's therapists, occupational therapists, which is what I am, physical therapists, and some massage therapists are learning this. It's a very calming and relaxing technique, and it stimulates the parasympathetic nervous system. So when we have anxiety and a lot of stress in our lives, it helps our bodies come to a more relaxed state. So his brain therapy treatment actually takes the lymphatic techniques to a different level, literally, from the linings of the cranium and the brain down into the structure of the brain. Dr. Chi Clay has developed different levels of treating the brain, and there's 5 different classes that people with advanced therapy can actually take. Some of my clients have given me quotes or testimonials to share with you today. This one is from a mother of a 10-year-old boy who received treatment for 8 to 9 months, about 17 treatments altogether. And she said, quote, "With our son having a stuttering problem, cranial or brain therapy has been very effective in helping him achieve fluency." So this young man started to come for brain therapy. He's had a stuttering problem his whole life. He's been in therapy, speech therapy, for at least 5 years. And even the speech therapist noted that his level of fluency accelerated dramatically over the time that he was receiving the brain treatments. We pretty much discharged him now. The therapist said that she was going to kind of see him a little bit here and there, but for the most part, his stuttering has resolved to the point where it's only when he's under extreme anxiety. Another girl that I've only seen for 4 treatments, she's 13 years old. She says, quote, "I feel calm and not so grumpy. I can pay attention at school better and not daydream as much. I laugh more." Her father, and the family has adopted this young girl, he said that, quote, "The morning after my daughter's first appointment, I noticed she was much more calm and happy than most mornings. She thanked me for taking her to Anne and gave me a very affectionate hug, which is very difficult for her to do." Real change overnight. This to me is amazing. To me, it's just it's a miraculous opportunity that we have to learn to work with the body and to work with the human beings instead of scalpels and knives and doing things through surgery. And I think that the potential is amazing. So what is this brain therapy good for? Dr. Chi Clay has a long list, but some of the things are just relaxing and helping to clear brain fog. People with head injuries. Something I see quite a bit of here is people with Lyme disease, whiplash, head injuries, learning disabilities, a wide variety of things that we can think of with children. The young girl that's 13 is on the autism spectrum. Dr. Chi Clay has a health institute, and his description of this the classes for the brain curriculum is that these are advanced classes, and they use a different paradigm than any of the other techniques for working with the head, and then they're working extensively with the brain parenchyma, the gray and the white matter, cranial nerves, vascular structures, rather than mainly with the bones and the membranes. And the interesting thing he also goes on to note is that when we have injuries, the body often aligns itself around the injuries that happen in the head. And until recently, we really haven't had a way to release and address these tissue strains and restrictions. So you probably are asking yourself, and this is what I ask myself, what does it look like and feel like to have brain therapy? And so I'm going to ask my volunteer, Kristen, to come up, and we're going to do a little demonstration. Now, Kristen is my neighbor, and she's never had brain therapy. I've never worked on her before, so this is an experiment. She did come over on the weekend, and I demonstrated some of the lymphatic drainage techniques on her liver so that I could show her what it felt like for me to work on her body in layers, what it felt like for me to engage her skin, her ribs, and an organ underneath the bone. And so now we're going to have a little bit of an experiment here. Kristen has a mic on so that she can give feedback, and I'm going to try to explain to you what I'm experiencing, and then Kristen will also give feedback. So you're good? Thank you. So when I work with somebody for this brain therapy, normally we want to have a relaxed room, not necessarily light shining in their eyes. But I'll start with some other light touch therapies for them to become relaxed before I would necessarily work directly on the head. So this would be me gently cradling her hair and just kind of letting her body know that there's going to be more contact on the way. And then I'll gently ease in so that I'm putting just a little bit of pressure on the skin of her scalp. If I wanted to, I could feel a little bit of glide of the skin. Do you feel that, Kristen?
I do, yes.
Okay, and now I'm engaging the bone. Does that feel different?
Mm-hmm. It's very subtle pressure, very subtle.
Okay. And now I'm going deeper, right through the bone. And now I'm on the dura mater lining. Does that feel different from the bone?
Mm-hmm. I can feel a little bit of movement.
Okay. And now I'm going to go just a little bit deeper. And then I'm starting to engage the lymph flow on one side. Can you tell which side?
My right side.
Yeah. So we're engaging the lymph flow. We're not at the brain yet. You feel any change now?
Mm-hmm. Yeah, to the left side.
And now I'm engaging the lymph on the left side. Now we're going to come down through. Okay. And this is one level deeper. This is the pia mater. This is a lining that covers the brain. It basically adheres to the brain, and it also has a lymph component. And I'm engaging the right side. Does it feel any different from the previous one?
Yeah, it's I can tell it's deeper, but it's not a hard pressure. It's just a.
Overall, how do you find the touch?
It's warm, and it's just a little bit of just very light pressure, relaxing.
Okay.
I feel like a warm kind of sensation running maybe down behind both of my ears, depending on the side that it's receiving the pressure.
Okay. Now we're going to go sink down through the brain and have a little bit of a paradigm shift to the ventricles. And the ventricles have cerebral spinal fluid in them. So immediately when I started to find the ventricles, I felt a movement. Do you have any sense of that?
Mm-hmm. Yeah, right in the top of my head, and then feels like my in my forehead, my sinuses have sort of opened up.
Okay, and the rhythm on the right and left are slightly different, which is typical. We're not the same. None of us are the same, right and left, and so we would expect to have a little change. What I'm doing now is that the lateral ventricles have like a back part we call the posterior horn, and I'm engaging the fluid in the way back on the right.
Mm-hmm.
And now it's kind of curling under, and now it's starting to switch direction. And we'll come back. And back to the middle and relaxed. Now, when I've worked with the brain, even just this little bit, it's a very personal experience. And so I wouldn't just go in and work and then just immediately take my hands off. There's kind of a gradual process of coming off through the layers. Could you feel any shift there?
Yeah, a little lightness.
And now we're going to come off another layer. And now I'm coming through the bony layer with my pressure. And now I'm more on the skin and the hair. And what I'd like is if, Kristen, if you would be able to sit up and just, we have just a little bit of time if you want to share anything. And you might feel a little different when you sit up.
Yeah. The pressure was very consistent, and when it started, it didn't feel like a lot of pressure. But then as you released, I could feel how deeply the touch had gone. I definitely could feel it. I did feel some movement while you were working. I could really felt like I could breathe very clearly. It was a very very deep breath that I was able to take, and just some warm sensations maybe coming down, the sides and kind of back of my head. So just overall very relaxing, very calming, soothing.
Calming, soothing.
Mm-hmm.
Is that something, would you call that pleasurable or stressful? Or, soothing not?
Yes, soothing is very, very pleasurable, very calming, and even in this setting, which is not very calming. So I think the fact that I was able to feel calm, particularly here, speaks to that.
Very good. Okay, so that's an example. That's how gentle it is. Generally, when we work with people like the children, it can be anywhere from 15 minutes up to 45 minutes, even up to an hour. So that's brain therapy. Thank you very much.